My experience with the biodentistry course has been phenomenal. I'm newer to biological dentistry in general. The foundational principles that I didn't come into dentistry with and didn't grow up with were really well explained on the content, like in the course itself. It was online, it was at my speed, at my pace, and I could rewind it and I could re-go over it and really kind of solidify the things that I wasn't sure of. So it really kind of helped me learn the basic principles. And since then, me and my family have implemented them into our house. So we're eating more whole foods, we're avoiding some of the toxins. And so it's been a really fun transition for my family to make the content part of our real life. So the content was great. All the communication was great. I've been emailed, anything that I wanted to know. I've been able to ask my questions. Everybody's been helpful on trying to get me on the website and get my name associated with this group. And so I feel very supported and very included in this process. I would recommend this biodentistry certification to anybody and everybody. Dentistry, we have a lot of power, we can have an effect in a lot of people's lives for the rest of their lives on the dentistry that we do, whatever we put in their mouth, if it's a crown or a root canal or a filling, they're going to have that for a long time. And so knowing the things that we can do to help increase people's health, not only to take away pain or make them chew or the local problem inside the mouth, but if we can increase their overall health, then they'll live a longer, happier life. And that is, in my mind, if someone wants to be a dentist and make an impact on people's lives, you have to focus on overall health. The program contributed to my overall professional development in a lot of ways. Like I said, I kind of just got into biodentistry and trying to understand what it is. And Dr. Dome has a lot of people worldwide that know him, that follow him, that recognize him. And as I got into biological dentistry, not every day, but at least once or twice a week, we would start talking about Dr. Dome and, hey, did you see the whatever podcast, or did you see whatever he published? And, do you believe in his protocol? The protocol is the biggest thing I think that people are searching for, because they want to be healthy and they recognize the benefits, the structure that has been provided. So he's reached out to dentists, but he's also reached out to patients. Coming here to Tübingen has tied the biggest knot, has tied the biggest bow in my whole education. I've been able to experience, to see real hand, the care that Dr. Dome has with his patients, the emphasis that he puts on with the patient during the surgery. How have they been eating, focus on their body, focus on their feelings, focus on the experience of what's happening, rather than just, do all these things for 2 months before you come and then come and get your surgery done. It's seeing him interact with the patients and what he talks about and how he motivates and how he encourages his patients here at the time of surgery, which is something that they've been preparing for months, was really great to see and really special, because you can take an education, but you can make it personal. You can make it real life. You can make it applicable in the moment. And that's, I think, the second half of the whole curriculum is knowing the information, but then knowing the patient and loving the patient and helping them in their health journey get better. There's a lot of things that I would hope to take away from this experience. The biggest thing is seeing the team interact with the patient and being able to encourage them and support them. Obviously, I got to see pretty much everything I'd want to see as a dentist: an immediate implant, a cavitation removal, a sinus lift. I've seen a lot of the technical skills of dentistry here, which I'll make little minute details to my surgical style. But the biggest thing I think that I'll take away is how to treat the staff and how to treat the patient and how to work this program into the conversation and into the way that I treat the patients.